So if you think about what's happening in the brain with substances, when we use alcohol or drugs, all sorts of feel good hormones are released, right? Dopamine, your endogenous opioid system, which is literally your natural pain reliever. And if you take someone who's experienced trauma, there's great relief that people can find in substance use. Since we saw that in the pandemic, like what was going on in the pandemic, people were scared, they were bored, they were lonely, they were stuck at home, they didn't have their usual routine. Some people were losing people that they loved. And so we saw all of this escalating substance use. And it was actually most pronounced in people who are frontline workers. So that could be a healthcare provider. It could also be someone working in a grocery store or a convenience store who had to work through the scariest times of the pandemic. And also people who are caregivers. So those are kind of the two groups that had the biggest increase in their substance use during the pandemic.
What is going on in the brain? You referenced it a
Yeah.
little bit there. You referenced that dopamine makes you feel
Yeah.
good.
Yeah.
So, very naively, I would assume a case if you feel bad, dopamine makes you feel good, you want more dopamine. But is it more complicated and nuanced than that?
Yeah, well, alcohol is a really complicated one because alcohol has lots of different effects on the brain. So any drug that can or substance that can cause addiction is going to release dopamine. That's sort of a primary driver of many things that we find rewarding, whether it's sex or food or alcohol or drugs. But alcohol also, so it binds to the part of our brain, a system called GABA, which is sort of our anti-anxiety system. So it's the same system that anxiety medications like people may have heard of Ativan or lorazepam or Xanax, these medications that are kind of sedatives and anxiety meds. Alcohol acts on that part of the brain. And it actually then causes a release of your endogenous opioids in your brain. So, like your brain's natural painkillers. So that's actually why one of the medications that's effective in helping people stop drink actually just blocks the opioid response in the brain, which doesn't make sense when you first hear about it until you understand these neural mechanisms that actually your sort of natural painkiller system is activated by drinking.